Hi guys, it's Christina, and I thought today I would address Fairly Local Vegan's video about how she is not doing well. This is, I think probably a couple weeks old. I just went through and watched the whole thing, and I thought I'd put in my 2 cents from a nurse's perspective. Now, Sea Siren Janine had done a video about this as well, and Fairly Local Vegan took it down. She copyright striked it. And so I'm not showing any clips of her stuff anyway, but I thought that was pretty crappy of her. Just because somebody's telling you something that you don't want to hear does not mean that you need to go and completely take it down. First off, what Sea Siren Janine did, the portions she did use was under fair use, and you abused the system at that point just because she was telling you something you didn't want to hear. And I thought better of you than that. I don't know if you'll ever watch this, but I thought a lot better of you than that. I generally like your channel. I like your videos. I thought you were a pretty nice person, but that was a bit much, and you may want to rethink your approach with people. That said, to other people watching this, Fairly Local Vegan has Crohn's, and she has celiac disease, and she is vegan. And because of the celiac disease, she genuinely has gluten intolerance. She has a bunch of allergies that she's gone in for tests for over the years. She's been dealing with chronic stomach pain for the last 14 or so years. Medically, she's got disorders that are very bad. I mean, this affects what she can eat, how she can live. She's dealing with chronic pain, things like that. And one of the things that she put in her video, she wanted to clarify to people that she does not have an eating disorder. Yeah, she's thin. Yeah, she's going to lose more weight, but she doesn't have an eating disorder. Anorexia can be induced by your disease processes. It doesn't mean, anorexia does not mean it's up here all the time. It can be induced by cancer medications. It can be induced by cancer. It can be induced by MS. My husband is facing bouts of anorexia. He has to force himself to eat, and that's because of the MS disease process, not related to his medications. I've seen patients that they've prescribed marijuana to get them to eat, to get them to have an appetite. Anorexia does not necessarily mean that you're having a psychological thing where you want to lose weight. And I just wanted to put that out there. So, Fairly Local Vegan, please don't feel bad about that. You are experiencing anorexia for a particular reason. Every time you eat, it hurts like your guts are being ripped out. Nobody is going to blame you for that one. It actually is a form of anorexia. So, you said that you're actually considering options that people have emailed you about, which you think are terrible in the first place, like urine therapy. There is no such thing as urine therapy. There is no benefit to drinking your own pee. People who think that are just, they're already up here having issues in the first place. That's not an option for a normal, sane person. Your body's kicking out those toxins in the first place. There's a reason your body is kicking that stuff out. And once urine reaches the outside, it's no longer sterile. It's sterile inside your body. It isn't once you pee it out, because then it's exposed to air, it's exposed to bacteria, bacteria around your vaginal area, all of that. But your body's using your kidneys and stuff to get that stuff out of you in the first place. And there is a reason. Putting it back in your body is not going to benefit you in any way, shape, or form. The other thing that you brought up was essential oils. Essential oils are topical use only. They are not for ingestion. Even then, they have to be diluted with a carrier oil, like cold-pressed avocado oil or cold-pressed almond oil, which I have with my massage therapy oils in my container. They're for massage therapy. Aromatherapy for calming is good, to just, sense, bring back memories, things like that, to relax you, to just make you emotionally feel better. Aromatherapy is good for that. But to say aromatherapy has a medical benefit beyond that, no, it doesn't. To say that ingesting these oils are going to help you, no, they're not. They're toxic. You are not supposed to take them orally. I suppose some people probably have, I know you didn't bring it up, but if somebody mentioned coffee enemas, please don't. Yeah, there's no benefit to that either, other than getting not only the caffeine into you, but also any toxins that are carried by the beans, because there's more chemicals in a coffee bean than caffeine. And some of those chemicals are hard enough on the body when you're ingesting it the normal way. But there's toxins and chemicals in there, and they go into your system faster if you're doing them rectally. And I did have to put that out there. I know that wasn't something you discussed at all, but I imagine you probably got an email about that. Just don't do it. Don't do it. I don't know if you actually did go to see a specialist about your outbreak of Crohn's. I imagine you did, because you've been dealing with this for years and you're actually diagnosed. If you didn't, please go to a specialist. Your situation is getting dire. You went and you mentioned how somebody told you to water fast for 30 days and then got mad at you when you told them no. You had the right instinct there. Just no. You're already on a bad path physically, and to fast for even a week is enough to probably do you in and hospitalize you. And I mean ICU hospitalize you at this point. Just ignore them, that are saying water fast. That can destroy your kidneys. That can make you go into water toxicity, which can bring you into a coma. It can bring you into death. Yeah, if you don't eat, and you're just drinking water, as I've said before, and this is a harsh statement, death cures everything. So don't listen to these people. You have children you have to take care of. You have children that rely on you. You need to live, and I'm not saying, that, I mean, there's some people that are on full life support and are in a coma that I've taken care of, or ones that are brain dead that I've taken care of that were still on life support. That's not living. I still go in and take care of them. I still treat them like they're there. I still treat them like they're, I talk to them. I bring my guitar in. I do all that stuff. That's not to say that I treat them any different than I do anybody else, but where's the point of living, And you are facing this as a very serious reality at this point on the path that you're going physically. And I'm not saying that this is your choice, because it isn't. Your body's doing this to you. I tell my husband that all the time when he apologizes for being in pain, and it's like, yeah, you didn't choose this, dear. And that's the same thing. But I think you need to take the actual medical route, and you also need to look at your diet. Your diet is not serving you. And while I get it that, you're there for ethical reasons, there is a point where you can't martyr yourself, especially when you have an infant and you have young children. You cannot martyr yourself at this point, because they're going to suffer for it for the rest of their lives if you do. And that's where you're heading. You need to talk to a dietitian that specializes in Crohn's and celiac, and you need to go back to the specialist. Doing these alternative medicines, and you're talking about how you're going to experiment and try to find what works and everything. You're going to die before you find what works at this rate. This is the cold hard truth. You need to get help now. And researching on the internet, researching holistic therapies and all this stuff, how do you know exactly what is real and what isn't? Other than it feels good to me or it feels right to me, that's not a determination. You need to actually go with science-based at this point to save your life and to help your kids have a brighter future, because they're not going to have a bright future as well without mom. And I can tell you're a fantastic mom. You love those babies. They know it. And they're going to have a really, really hard time without you. So you may have to toss the ethics aside and do what the doctor tells you and do what the specialist dietitian tells you. And if they tell you to do meat and dairy, guess what? You can still be conscious here. You can still be caring here. But if your body doesn't allow you to do it, your body doesn't allow you to do it. And if you're still going to fight with it beyond that point, when they tell you, hey, this is how you're not going to suffer as badly as you have been, and this is going to keep you alive, and you still refuse to do it because of these ethical reasons, that's not a good attitude to take. You really, really need to think about your family first and yourself first. And you are miserable. Living on pureed zucchini guts and fruit juice is not a living. You're going to waste away. You are wasting away. You've said that. So, and the reason your doctor, and I imagine your doctor didn't want to hear too much because you brought up Goji Man and his scam tests that he's making money off of. Those tests don't mean anything. And that's why your doctor didn't want to hear that. You talked in your own video about how a lot of these holistic things are there out to just make money and to line the pockets of the people selling it. That's what Goji Man is doing with those tests. You are under specialist medical needs, and he is by far not the person to handle it for you. He's making money off of you and off of everybody else he sells these tests to. And you also made it sound that you think that the doctor is getting kickbacks for prescribing medications because you went and you said, well, he'd make money off of it. He's only making so much money. He has to see so many patients a day. My own doctor gets 20 minutes per patient because the government has gone that tight on their pay. And the insurance companies are cracking down on how much doctors get paid and how much time they have for patients and what medications can be approved and what can't and everything. And what diseases can be treated and what can't. It's not your doctor that is the problem here. I've said this in many other videos. The problem is the insurance companies. My own won't even pay for a medication I need. I have to pay out of pocket for it. And I've seen insurance companies refuse to pay for basic stuff that a patient has to have, so the families have to pay out of pocket. So no, your doctor's not making the profit. The insurance company's making the profit. And you need to get that right. I say that with a lot of people because that's the fact of the matter. Your doctors are not making as much money as you think. High-level surgeons and things like that, yeah, they're getting the serious pay, but if they're working on your brain, they kind of need to have pay, okay? But you need to get that correct. But even then, you don't have much time, and you need to go with what has been proven to work. And you said yourself, you're still going to be miserable. Okay, but are you going to be as miserable? And that's why you need to do not just the medications, but you need to go to the specialist dietitian. You need a specialist at this point. You need to save your life. You need to be there for your husband. You need to be there for your kids. You need to be there for yourself. You don't need to suffer just because you're vegan. So for anybody watching this, hopefully, you know, even if she doesn't watch it, hopefully somebody out there will listen and, you know, you can take this to heart. These are my opinions, my professional opinion as well as personal, from being a mom, from being an RN. And I just want to put that caveat out there. And yeah, it's not one of my more happy videos, but a fairly local vegan, once again, I love you. I think your channel's fantastic. People are still going to stand by you, even if you have to make these dietary changes. So if people walk away, that's their problem. That's their loss, not yours. Anyway, blessed be everybody. Have a great day.